Okay, and welcome to the second video, Unit 2, where we're going to answer pretty much the most commonly asked question here. I know I'll probably say that a lot, but we get a lot of questions, and I just want to make sure that those questions get answered first and foremost. So, a common question we see posted in the group is, do I have a vagus nerve issue? Here are the issues I have. Is this related to a vagus nerve issue? We're going to go over that in this video specifically and try to answer as many of your specific questions as possible. So, first we have to know, where does the vagus nerve go to understand if it could be related to an issue that you might be having. Okay, so you can put your face really close up to the screen and get a good look at this picture. So, first we have at the very tippy top in bold, vagus nerve. That's where with a little circle, it's coming right out of your skull. This is as close to the brain as you can get, pretty much. So, then it goes down to your pharyngeal, this is your throat, your voice box, the place where you swallow, and then it wraps around your esophagus. So when you swallow food and it goes down your esophagus, and you induce peristalsis, which is where your stomach, your esophagus starts squeezing food down your throat. That's also your vagus nerve, okay? So what we're going to go through real briefly are I'm going to go down the list systematically, just so you can follow, and just pay attention and listen. And if you hear an area that think about in the back of your head, what are some of the symptoms that you're having? You might be thinking to yourself right now, well, I have some weird heartbeat stuff. I'm just going to listen to this and see if he mentions heartbeat, okay? Or maybe you're like, you know what, I got some issues in my intestines. I'm just going to keep on listening to see if it could be related to the vagus nerve, okay? So I'm just going to go through here and talk about, just very briefly, areas of issues with the vagus nerve, okay? So we went over the esophagus, that's issues swallowing. The heart can have issues because the vagus nerve can get weird skipped beats, low heart rate, high blood pressure, lots of these kinds of things. The lungs not being able to take a full deep breath. The liver can be affected, as well as the stomach, okay? Another issue is acid reflux. That's very common. People get a hiatal or a hiatus hernia, which is where their stomach goes through their diaphragm and gets squeezed, and you can see just how much the yellow vagus nerve innervates around the esophageal plexus. So that puts more pressure on the vagus nerve, and heartburn might actually be an issue of vagus nerve irritation and not necessarily just acid coming up your esophagus, possible. The spleen, the kidneys, a lot of things with hormones, digestion of food, insulin, this is related to diabetes, macrophages, it connects to your gallbladder, your pancreas. So, insulin release, blood sugar, lots of stuff with, hormones related to cortisol, adrenaline, that kind of stuff. Your colon, your small intestine, so digestion down there. Also, it does connect to your reproductive organs. So if you have any problems with dysfunction down there, reproductive issues, period issues, menopause, a lot of these things are very related to cycles within the vagus nerve, okay? Fair enough? Alright, moving on. So the vagus nerve and inflammation. How is it possible that all of these things could happen but in different areas? If the vagus nerve connects to all of them, why don't they all just fail all at once? Well, that's because the vagus nerve is like a system for your brain to have a nose in your body. It's able to smell things in your system to make sure that you don't have pathogens or intruders or anything like that, okay? So it detects mold, chemical toxins, parasites, bacteria, infections, blood-borne illnesses, tick-borne illnesses, these kinds of things, okay? Now, when the vagus nerve does sniff something really bad, then it's going to signal the body to start producing cytokines, inflammatory cytokines. These are like the police guard, the security officers, the SWAT team, the Navy SEALs. They're going to go down to the area where the infection is and go and try and fight it with like white blood cells, inflammatory cytokines that can go and attack specifically these targeted bacteria, parasites, spores, whatever it might be. Okay, so normally these cytokines destroy the intruder successfully. Your body is constantly, keeping equilibrium with whatever is in your body. But sometimes, if your vagus nerve, because of trauma or injury, isn't able to signal the body to turn off the production of cytokines, it's basically not able to say, okay, stop sending police cards. This whole building is completely full of police cards, and they're going to start doing something crazy soon, and these cytokines start attacking normal host cells. This is really bad. This is attacking your own healthy cells, tissues, and neurons. And this is what we call an autoimmune disorder. Autoimmunity disorders are very common, and out of, I think the latest numbers are about 50 million people just in America alone. It's likely a lot higher across the whole world, but I have data on the United States. 50 million in the United States. Just for reference, 80% of those are women. Okay, so it's most likely that women are affected by autoimmune disorders. Okay, so that's another thing you can use to gauge if do you have an autoimmune disorder. Be like, am I a woman? Am I a man? If you're like, I'm a woman, then it's like you have a 4 times chance higher than men to be suffering from an autoimmune disorder. I hope that makes sense. Okay, so the vagus nerve infection hypothesis is really, really critical in understanding whether or not something might be going on. Some people come here because they have Lyme disease or they have some infection or whatever, and they're like, well, it's the Lyme disease that's doing bad things to me. Well, actually, the thing that Lyme does, whatever Lyme might be, if it's an infection, like a bacteria or a pathogen or whatever it is, I can almost guarantee you that the first place that a mold or a pathogen or a bacteria would want to go attack would be your vagus nerve. Here's why. If I were going to occupy a large office building, like let's say I wanted to take over a skyscraper in Manhattan. I wanted to go to New York City and just take over the biggest building there. And I wanted to send in, let's say I wanted to send in like 100 men, 100 people into this building and take it hostage, okay? Alright, so there's security guards inside the building already that are looking out for this kind of thing to happen. They're armed, they're ready to go. If I were going to send these people in, the first place that I would want to send in these 100 people that are going to take hostage of this building, the first place that I would want to attack is the security center, the place that's going to alert other people to come to their assistance, right? What's the first thing that people do when they rob a bank? They try to cover the cameras. They try to elude detection. They try to turn off the alarm systems. An infection hypothesis is essentially saying that the vagus nerve is the first place that bacteria and pathogens want to go to destroy to be able to create a good host system in your body. So if you're feeling sick, it's likely that yes, there could have been some pathogen bacterial infection that got into you. But it's not that thing that's continuing to do the damage. What it's done is it's impaired your immune system by impairing your vagus nerve. The good news is you can heal your vagus nerve, but you just have to start thinking about it this way. They're going after the security system. The first thing you want to do if a bank is being robbed is you want one of those tellers behind the counter to hit the alert button under the counter telling them to call for backup. That's the first thing any robber is going to know about and try to prevent from happening, right? So your vagus nerve is your first responding system. It's the first system that goes, oh my God, there's something really bad. We just got bit by something. We just inhaled a bunch of spores. We got to get to the rescue. And it's a battle of time between the pathogen and the vagus nerve, trying to fight. The vagus nerve is working for you. The pathogens are working against you. So this is essentially a pretty compelling hypothesis understanding and underlying why so many people end up in this group with vagus nerve issues, even though they have, some other thing that they think they have, which they do, but the vagus nerve is underpinning that in a big way. Okay? So this is a picture of a neuron, just so you get a better sense of it. On the left side is the main cell body, and the middle is the axon with a myelin sheath, which is a protective bubble cover. and that goes to axon terminals, alright? So when you get attacked, the first thing that a infection thing would do, a pathogen would do to you, is try to destroy the myelin sheath. Less myelin sheath means less electricity going down to your axons, and your vagus nerve is a large neuronal system with axons that are extremely long, like the length of a football field in comparison to the size of a football. If you're doing some kind of comparison between the size of the cell body and the length of the axon, right? So if the cell body was the size of a football at one side of the football field, the axon would be the length of the entire football field. So it's very, very important, and the axons would be at the other end. Okay, so that's just how really long this is, and the axons are really important in protecting your body. Okay, so just so you know that. Now, autoimmune disorders, listen up. Irritable bowel disorder is a very common one. This is from a large list. These are the most common ones that people come here for, and that I've seen when people talk about autoimmune disorders, and they are related to the vagus nerve and the immune system. Okay, so pay attention. Celiac, Crohn's disease, depression, anxiety, rheumatoid arthritis, psoriasis, skin disorder, type 1 diabetes, multiple sclerosis, asthma, fibromyalgia, and over 100 more types. So if you are able to focus on the vagus nerve, you can underpin the autoimmune issues and actually promote healing, okay? So that's why we really encourage you to spend time focusing on the vagus nerve if you suffer from any of these things. Because look, what do you have to lose, right? If you got the issue, then, I promise you the pills you're going to be getting are just going to help manage the symptoms, and they're not going to be healing you. There's no such pill that has been able to reverse these things as far as I know. Most of these pills are just designed to manage your symptoms and get you on these pills for probably the rest of your life. Okay, that's just the truth. Alright, moving on. So the key contributors to autoimmunity: location, whether it's your lungs, your heart, your intestines, your stomach, your esophagus, your skin, your reproductive organs, whatever, is genetics, environment, trauma, stress, and other things. Healing the vagus nerve does allow you to heal the autoimmune disorder, but it's not a guaranteed thing, okay? The repair cycle is between 90 days to could be an entire year, could take 360 days, but usually you'll start seeing, if you stick to something with consistency and a plan, 90 days you can make a huge amount of progress towards these things and really be like, wow, I feel like a lot better. If you're unsure still at this stage, if you have a vagus nerve disorder or whatever, then I really want to encourage you right now just to keep on watching this training material. We have a lot more on the way, a lot more good material. And even if you're like, I feel pretty healthy, but I have some of these issues like brain fog or maybe a little bit of anxiety, depression, stress, whatever, the exercises that I'm going to be giving you in the next few videos are going to change your life. I can guarantee you that. Okay, so just keep on watching these. These are good for everybody from any spectrum. Even the most healthy people do the exercises that I'm going to present to you in the next few videos, and it gives them a huge boost, huge performance enhancement. It works for everybody, okay? So the healing can start as early as today if you just keep on watching these videos. And the key to all of this working is that you are consistent, okay? If you just do this once or twice or maybe 3 times in the week and then just stop, I'm sorry to tell you, you're not going to get good results, okay? You're going to get poor results, all right? If you do it consistently, 7 days a week, 4 days a month, or 4 weeks per month and 12 months per year, if you stick with it consistently, you can make huge leaps and bounds ahead of this problem, okay? So that's it for this video. I just want you to know that relief is on the way, okay? Keep watching for more ways to start stimulating your vagus nerve. Thank you guys so much, and I'll see you in the next video. Bye-bye.